Hello friends, I'm sharing here with a success story of a couple who recently delivered a baby with me. This couple came to me almost about a year back and they had already undergone one IVF cycle. During the course of that cycle, they realized that they obtained about 3 eggs and only one embryo formed, and this embryo went to about day 3 of development, and obviously it was not successful. And they were quite dejected, because the doctor then and everybody advised them that in spite of your young age, you are producing very less number of eggs and the eggs are of not great quality, and hence probably you should choose to go for a donor gamete program, that accept a donor egg program. This lady is a doctor, very intelligent, and she would say, well, donor eggs is just not acceptable to me. When they consulted me, I said, well, that could be a result of one particular cycle. That in particular cycle, the herd of follicles which are developing might not have given you a right number of eggs, and the quality of eggs might have suffered. That doesn't mean that your egg quality is always bad. Because the quality of egg is mainly decided by your age, your body mass index, that is your obesity, and your FSH level. Fortunately, she's thin, her FSH levels were normal, and her age was only 35 years of age. I said, at 35, you are on a cusp. Henceforward, the quality of eggs will deteriorate as you grow older and older, especially as you grow beyond 38 years of age. And we should try with the right dosages and with the correct drug therapies. So I went back to her notes in the previous cycle, and she had received urinary HMG protocols. I told her that it's better we give a better thirst of follicles with FSH injections, and a consistent FSH dosages must be given. We chose to administer her a 300 IU of recombinant FSH and 150 IU of HMG combination to give her a right dose of FSH and LH activity. But before this, we gave her loads of mito-Q, that is coenzyme Q, so that the egg quality is better. We looked at the vitamin D levels and corrected the vitamin D levels also for her. And also, she was given estrogen tablets for a certain amount of time. Estrogen pre-treatment is a correct pre-treatment. What happens with estrogen is the FSH levels in your body do not grow. So the eggs do not grow well. And because of this, the eggs start accumulating at smaller sizes, and that's exactly what we want. Irrespective of what your menstrual date is, if we are able to give some estrogen treatment to you and accumulate the number of eggs so that we can take a certain number of eggs accumulated. So instead of having on day 2 or day 3 of the menses 3 or 4 eggs, suppose you have about 7 or 8 eggs, your development of that herd will be better. And that exactly we did in this particular client. And we obviously used a higher dose and used a recombinant FSH, which has a better thirst to the development of follicles. She went ahead and gave about 4 good blastocysts. We transferred 2 blastocysts, and there she was. She was pregnant with a single pregnancy, and she delivered subsequently. And believe me, I still have 2 more blastocysts with me. The moral is, here was a couple who was advised that, well, your egg quality is bad and you go for a donor egg program. And with a correct dosage, correct kind of pre-treatment, a properly conducted IVF protocol, she already has a baby and has 2 more blastocysts stored with me. She need not bother about her age now. She can go over for another 2 years and 3 years. These embryos will be very safe with us. She can take 1 more transfer when she's about 37, 38, and she's come out of responsibilities of this baby and wants to have another baby. And even probably her family with 2 kids could be complete. I just pray that that really happens with her with the next, she achieves her next pregnancy as well. Thank you so much.